A change of season hasn't altered the situation, but still the Premier is giving the state something to look forward to.
September is the month when we're asking everybody to get ready.
Get ready to possibly eat out, grab a drink with friends, go to an event or have a makeover when 70% of the adult population in the state is fully vaccinated mid-October.
No matter where you live, life will be much, much better, much freer, so long as you're vaccinated.
There'll be rules with the freedoms, capacity limits, spacing at venues, check-ins and mask wearing. And the easing of restrictions is unlikely to include having people over to your home.
It would be far safer, for example, for a family to have a meal in a restaurant than it would be necessarily to have people come into their home that may or may not be vaccinated.
The Premier is again promising further changes when the 80% target is achieved. She wants the Commonwealth to allow international travel to recommence and the hotel quarantine system to change.
If they're double dose vaccinated, I think home quarantine is a definite.
But the state isn't there yet. From tomorrow, it'll be 70% with one dose of the vaccine. In the hotspots, the Blacktown area already has more than 70%, and Parramatta and the southwest are close, while the northwest, which isn't in a hotspot, is almost at 80%. Case numbers remain high, and there are 4 more deaths, taking the toll to 100 over the past 2 months. Hospital admissions have again increased, and there are 150 COVID-positive people in intensive care.
The most recent advice that I have received is that case numbers are likely to continue to rise for the next few weeks, and the worst hospitalisation rate is likely to be in October.
It's unclear how those rising case numbers will influence the freedoms granted when that 70% target is reached, and whether they'll be the same for hotspot and non-hotspot areas. Those details are still being finalised. The mayors in the hardest hit areas wanted to have a meeting with the Premier, but she's refused.
In Canterbury Bankstown, we have high case numbers and we have high vaccination numbers, and we don't know what the relief is going to be. We want the Premier to give us the roadmap, tell us what she's thinking.
The Premier insists she regularly meets with community leaders. Ashley Raper, ABC News, Sydney.
The Far North Coast has been on high alert because of fears a positive COVID case may have visited a remote Indigenous community. Contact tracers immediately mobilised, trying to identify any potential exposure sites. Leah White is in Casino, and Leah, you have some positive breaking news for us.
That's right, Juanita. The local health district has just confirmed that the case that they were concerned about was not infectious in the Casino area. They now believe that that person acquired their infection when they returned to Sydney after August 21st. So health authorities say there is no risk to the community from that person's visit. About 200 people live in the Aboriginal community of Muli Muli, which went on alert for possible exposure to COVID-19.
They were a little bit upset, when everyone first arrived here, this morning, the police and the health service.
Residents were surprised to hear that a positive case may have visited the area.
We've tried to be protective and, manage this COVID as best as we can.
People were hoping there wasn't a repeat of the situation in Western New South Wales, which is still grappling with the rising cases. AUSMAT, a team of medical professionals often deployed overseas, is this time helping at home with a door-to-door vaccination drive across the region.
Some people don't want to be vaccinated, but many people who are at home, once you have a chat to them, and as long as there's people there who can help you with the conversation, they'll accept vaccination.
In the Far West, first-dose vaccinations have risen by almost 14% over the past week to more than 65%. New cases for the state's west were down today at 29. There were 3 in the Far West, 8 in the Illawarra Shoalhaven, 6 in Hunter, New England and 2 on the Central Coast. In Wilcannia, where accommodation is in short supply for those who are isolating, 30 motorhomes will be made available at the local campsite.
They'll have access to power and water and, of course, waste disposal, and this has been already communicated with the community.
For the Northern Rivers, it's proving a tense time in a border region struggling with the impact of the lockdown. Leah White, ABC News, Casino.
The fate of healthcare workers who refuse to get vaccinated is still being decided. The Premier says she's confident that the vast majority will comply with the health order by the end of this month. But new data reveals thousands of staff still haven't had a single dose. Tim Swanston explains.
It's the first day of September and the deadline for healthcare workers to have at least one dose is fast approaching. It's just 4 weeks away. But 18% of staff still aren't vaccinated. The problem's even worse in regional areas where almost a quarter don't have any protection. One union says many healthcare workers have been too busy. Others still have questions.
I think there's probably up to 10% of people who are still hesitant, still want to be able to have it explained to them fully.
And Gerard Hayes believes even then, 1 or 2% of personnel will still reject the jab. So what happens to them? Next month is expected to be hospitals' busiest.
They're not in a position where they have the luxury of having overwhelming resources and reserves.
Certainly, we want to be fair to the workers, but also accommodating along the way, but also accept that if you look at the statistics, too many people acquired COVID whilst in a healthcare setting.
Airlines have also ordered their workers to roll up their sleeves, and school staff don't have a choice either. But what about other risky workplaces?
This is not a time to start getting stubborn because you feel, as a matter of principle, that individual rights are being, your individual rights are being infringed. This is an unprecedented situation, I think, that we find ourselves in.
As we adjust to living with the virus, it's a question more of us are likely to confront. Tim Swanston, ABC News, Sydney.
New federal government data has revealed stark gaps in vaccination rates for Indigenous populations across the country. Less than 10% of Aboriginal people in communities in outback Western Australia are fully immunised. Health services there say they fear an outbreak could be devastating. And Indigenous populations at the centre of the Western New South Wales outbreak have the lowest vaccination rates in the state. 13% of Aboriginal people are fully vaccinated. The highest percentage is in Melbourne's inner east, sitting at more than 70% fully vaccinated. The data is based on First Nations people aged 15 and over. Let's take a look at vaccination rates generally. As we've heard, almost 70% of New South Wales residents aged over 16 have received their first dose. Almost 38% are now fully vaccinated. Nationally, the figures are a bit lower, with almost 60% of those eligible having received their first vaccine.